Disclaimer: We Level Up is not promoting the use of psilocybin. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: can you smoke shrooms? Consider the consequences before attempting to smoke magic mushrooms. While it's possible to smoke mushrooms, it is uncertain that you can get the same psychedelic effects as eating them. Crushing dried magic mushrooms into powder and smoking them alone, with tobacco or cannabis, or using purified psilocybin crystals in pipes is not advisable. Can you smoke shrooms? Here's what you should know before smoking magic mushrooms. Smoking magic mushrooms comes with risks, including the possibility of overdose and the development of substance use disorder, SUD. Smoking them adds dangers, harming the respiratory system with high heat. Controlling dosage is harder, increasing the risk of harmful experiences due to variations in psilocybin content. What are shrooms? Magic mushrooms have been used for centuries by various cultures for their psychoactive effects. The main active ingredient in magic mushrooms is psilocybin, a naturally occurring psychedelic compound. Psilocybin has been shown to have profound psychological effects and is now being studied to determine if it can be used safely to treat various mental disorders. People can get wet and dry magic mushrooms, typically dried before consumption. Once dried, individuals eat them either on their own or mix them with other foods to help mitigate the strong and unpleasant flavor. Other typical methods of use include the following: making tea out of them, turning them into chocolate, edibles, grinding them into a powder, taking capsules. What are shrooms used for? From treating depression to helping address alcohol addiction, researchers say legal, medical, magic mushrooms have many potential benefits. Mushrooms are essential sources of bioactive chemicals and have antimicrobial, immunological, and cholesterol-lowering properties. Some mushroom extracts support human health and are available as dietary supplements due to these qualities. What happens if you smoke shrooms? Can you smoke magic mushrooms? This debate has been legitimately dangerous for those who engage. Errant spores could end up in your lungs, capable of wreaking serious havoc on your body. Aspergillosis, a respiratory infection caused by exposure to fungus, is one of the most significant risk factors and could lead to severe illness, including blood vessel damage. Other symptoms include wheezing, shortness of breath, fatigue, headache, and skin lesions. Treatment for aspergillosis will vary depending on the severity of the case but may consist of antibiotics or surgery for those with severe infections. Bottom line: smoking mushrooms isn't worth it. Between the respiratory health risks from fungal exposure and the fact that you'll likely burn up the active ingredients to gain the psychedelic effects, there's no legitimate argument in favor of the practice. Dangers of smoking shrooms. Bad trips. Smoking shrooms doesn't activate psilocybin, and this could lead to reckless use of the substance. Shrooms can lead to intense and unpleasant psychedelic experiences, causing anxiety, paranoia, and hallucinations. Gateway to riskier behavior. When the effects of smoking shrooms diminish, individuals might be tempted to experiment with more potent or dangerous substances, increasing the risk of harm and addiction. Respiratory issues. Inhaling the burning mushrooms can harm the respiratory system, leading to short-term or long-term respiratory problems. Difficulty in dosage control. Smoking makes it challenging to control the dosage, increasing the risk of taking too much or too little of the psychedelic compound. Variability in psilocybin content. Different mushroom species have varying levels of psilocybin, making it harder to gauge the potency and increasing the likelihood of adverse reactions. Mental dependence. Continuous smoking may lead to a mental dependence on the psychedelic effects, with individuals feeling the need to smoke mushrooms to maintain a sense of normalcy. Impact on daily functioning. Substance use, including smoking shrooms, may interfere with daily life, affecting performance at work or school and straining relationships with family and friends. Legal consequences. Smoking shrooms is illegal in many places, leading to potential legal issues and consequences for those caught in possession or using the substance. Lack of research and guidance. Smoking shrooms lacks scientific backing and guidance, increasing the potential for individuals to engage in unsafe practices without proper understanding or support. Physical side effects of smoking shrooms. The method of smoking introduces unforeseen and potentially harmful side effects, impacting both the mind and body. But here are the general side effects of smoked mushrooms. Respiratory issues. Elevated heart rate. Nausea. Dizziness. Sweating. Increased blood pressure. Coordination issues. Dilated pupils. Dry mouth. Fatigue. Chills or sweating. Muscle weakness. Impaired judgment. Altered perception of time. Loss of appetite. On top of these physical effects, higher doses of shrooms and other hallucinogens can change your perception of reality, potentially leading to unusual actions. Smoking shrooms may not induce an intense trip, but there's still a possibility, so be prepared. Are shrooms safe? Are shrooms safe to use? This is a question that many people have asked, and it is not quickly answered. While shrooms have a reputation for being a safe and natural way to experience altered states of consciousness, there are some potential risks and side effects associated with their use. Shrooms are a type of mushroom that contains the psychoactive compound psilocybin. When consumed, psilocybin is converted into psilocin, which is responsible for the psychedelic effects of shrooms. These effects can include changes in perception, mood, and cognition. While there is no evidence to suggest that shrooms are addictive, there is a potential for abuse and dependency. Users have been reported to experience adverse shroom side effects such as paranoia, anxiety, and delusions. Shrooms are also not recommended for people with mental health conditions such as schizophrenia or bipolar disorder due to the risk of exacerbating symptoms. Also, shrooms should not be used by pregnant women or people who are taking certain medications, as there could be dangerous interactions. Overall, shrooms are considered safe when used responsibly and for medical research. However, knowing the potential risks and side effects is essential before using them. If you have any concerns, speak with a medical professional. Safety tips. Start with a small dose. Begin with a low dose to gauge your body's reaction and minimize the risk of overwhelming effects. Set and setting. Choose a comfortable and safe environment, preferably with trusted companions. Stay hydrated. Drink water to stay hydrated, but avoid excessive amounts to prevent hyponatremia. Avoid mixing substances. Refrain from combining shrooms with other substances, including alcohol, to reduce the risk of adverse reactions. Know the source. Ensure you obtain shrooms from a reliable and reputable source to minimize the risk of consuming contaminated or dangerous substances. Have a trip sitter. Have a sober and experienced friend as a trip sitter to support and assist if needed. Mindset matters. Approach the experience positively, as your mental state can significantly influence the trip. Be aware of personal health. Individuals with a history of mental health issues or on medication should consult a healthcare professional before using shrooms. Plan for duration. Understand that the effects of shrooms can last several hours, so plan accordingly and avoid responsibilities during this time. Emergency contact. Share your plans with someone you trust and provide them with emergency contact information. Know the legal status. Be aware of the legal status of psilocybin mushrooms in your location to avoid legal consequences. Trust your intuition. If you feel uncomfortable or unsafe at any point during the experience, trust your instincts and seek support. Being aware of potential signs of trouble when using shrooms is crucial. If you or someone else experiences trouble breathing, an irregular heartbeat, agitation, aggression, or seizures after taking shrooms, it's essential to act promptly. Call 911 immediately to seek emergency medical assistance. These symptoms can indicate a severe reaction or medical emergency, and prompt intervention is necessary to ensure safety and well-being. If you or someone you know is dealing with shroom addiction, We Level Up New Jersey Detox Center provides personalized care with a team of experienced professionals. Begin your journey towards better health by taking the first step towards healing. Get help. Call We Level Up NJ now. Each call is free and confidential. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.